The mayor of Chicago.
Shocked a lot of people around this country. 72% of your city's deaths have been among black Chicagoans, according to your office, even though they make up just 30% of the city's population. Why is this having such a heavy toll in the black community?
Well, this is an issue that's not unique to Chicago, unfortunately. We're seeing similar kinds of numbers reported across the country in large urban centers. And the answer that we believe is right is because of the underlying conditions that people of color, particularly black folks, suffer from, whether it's diabetes, heart disease,
Right.
upper respiratory illnesses, the kind of things that we've been talking about for a long time that plague black Chicago, that lead to life expectancy gaps. This virus attacks those underlying conditions with a vengeance. Just this morning, I learned of a man that I know well, African American, had an underlying condition and went very quickly as a result of the coronavirus. So it is devastating our community.
What you said got the attention of the White House as well. The Surgeon General said from the podium that black Americans are not biologically or genetically predisposed. This is socially predisposed because of pre-existing health issues. He rattled off a number of other factors. The point being, this is so layered in complexity. How do you as a mayor start chipping away at this?
Well, you start by making sure that you've got the data. One of the first things that we did is made sure that we issued an order to require all providers who are doing testing not to skip providing demographic information. We need to be able to accurately understand the impact of this virus. So that's one. Get the data, share the data, and then what we also put in place was a racial equity rapid response team. So this is a team of healthcare providers, public health clinicians, as well as stakeholders in the community, faith community, block clubs. We have street intervention folks who normally work on responding to violence. We are going all in a hyper-local focus to make sure that we are tapping into those neighborhoods where there's a high death rate, where there's a high positive test rate, and we are bringing people into healthcare systems and making those kind of connections that may not have otherwise existed. But that's the kind of hyper-local focus, along with some other measures that we're doing to disabuse people of the myth that was circulating up until recently that black people actually couldn't get coronavirus.
One of the other stats that stood out is that so many essential workers, frontline workers, are people of color. So when it comes to that factor, whose responsibility is it to provide protective equipment? Is it that individual's employer? Is it the mayor, like you? Is it the federal government?
Look, I think it starts with the employer. We're calling these people to work. We have a responsibility to make sure that they're taken care of. So for the employers that